With summer here, parents have been hot to ask me what I would recommend to protect their children from the dangers of the sun. Well, let me see if I can shed some bright ideas on this particular topic. Turns out that one blistering sunburn in a child will more than double their risk of getting skin cancer as an adult. Yet the use of good sun protection and a sunscreen will cut that risk by more than 80%. Let's start with babies. Babies shouldn't be in the sun at all. They have sensitive skin, so if you're bringing them outside, they should be under a sunshade in a stroller, under an umbrella. They should have a hat, a t-shirt that covers most of their body, and they should have sunglasses. That's right, sunglasses. You see, the sun's rays cause their most damage to the back of the eye or the retina before your child is 10 years of age. So protect those eyes for the future by putting sunglasses on infants, children, and your teenagers when they're out in the sun. But the real way to protect your child is with a good sunscreen. I like sunscreens that have a sun protection factor of at least 30 to 50. Above 50 is not going to make much of a difference. You want to put this on generously on your children. Can even go on the exposed areas of skin on babies, but babies really should be out of the sun. But put it on at least 30 minutes before your kids are outside and reapply it every 1.5 to 2 hours frequently to keep your children protected from the sun. If it's waterproof, again, your kids come out of the water, put it on anyway. Sweat resistant, again, every 1.5 to 2 hours. Another good idea is to make sure that your children are not in the sun between the hours of 10 and 2 in the afternoon. But if a sunburn occurs, what you're going to want to do is use cool compresses. You're probably going to want to use acetaminophen to help cut the pain. And of course, you might want to try some aloe vera gel or lotion, which helps reduce the redness and the stinging. But it's always harder to treat sunburn than it is to prevent it. So that hopefully tips like this will bring rays of hope, just not a lot of the sun's rays, and shed some light, just not a lot of sunlight, when it comes to protecting your children from the dangers of the sun. This is pediatrician Dr. Lewis First from the University of Vermont Children's Hospital, reminding you to be careful out there in the sun and to always be first with your kids.